Hello, my dear friends. Welcome to Aspire32. And today we are back with another very important podcast. And this is a very important podcast for me because it is something related to endodontics, which I belong to. And this podcast is again more special because our own alumni, a very good student from KLE Dental Sciences Department of Endodontics, that is Dr. Priya. She's here on Aspire 32 to speak about the residency in endodontics in USA, and she finished it from Southern Illinois. And welcome to Aspire 32, Dr. Priya, and it's amazing to see you after so many years.
Yeah, thank you so much for having me here. It's a great pleasure to be talking to you after such a long time, especially when I've been taught by you, so it makes a big difference. Yeah.
Thank you. Thank you. So I'm excited to listen to this because you have finished your MDS in India, and then you did your DDS again, right? You finished your DDS.
Right.
And then again you did your residency, the master's in endodontics. So we can get a very nice information from you to compare how the endodontics in India can evolve better compared to your United States, and of course the application process and common things which are very important for students. So my first question is, I don't know whether this is a very right question to ask, but you finished your MDS here and in endodontics, and then you did your DDS. Why did you feel like again doing my residency or masters in endodontics again?
That's actually a very good question and something that's very close to my heart. I know many people it's a long, tedious process to even get your DDS in the US, but endo has always been very close to my heart. And I invested 3 years back in India doing conservative dentistry and endodontic. So part of me always wanted to go back and do that all the time. So here in the US, it's a little different on how we practice specialty compared to India. So in India, even if you were a specialist, you can still do some aspects of general dentistry. But here, if you want to do complex cases for endodontics, you usually want to go see a specialist. So if you really love endo, you have to be specialized in that particular field. And when you have done a specialty, you can't really do general dentistry. So I always wanted to go back to endo, do something that I really like doing. And so I was like, okay, I'll go ahead and do 2 years of 2 more years of training. And that's why I decided to do endo. Oh, I was just saying that here, like in India, it's combined conservative dentistry and endodontics, but here it's only endodontics. So you're only focusing on the endo aspect.
So of course, in India, you also had conservative dentistry and endodontics. The endodontics was your passion?
It actually was. I honestly liked aesthetics and conservative dentistry, but I liked endo more definitely because it's pretty challenging and you never get bored of doing it, even though you're doing the same procedure, but there is no clear recipe to it. Every case is different, so there's always something new to learn, and that's why. And obviously, relieving the patient of the pain, the kind of pain that endo patients have, is different compared to with just a filling, or if you're giving them doing an aesthetic procedure for them. So yeah, I was always wanting to do endo. I always was more inclined towards endo.
True, and I know, how fascinating it is to see the cases, the anatomies, and so many different metallurgies of files and everything. So you finished your DDS and you thought I will do this endodontics again. So how was the procedure? Like, was it very difficult? How was the process? How is the application process? Is it through the ADA pass cycle?
Yes. So most of the endo programs, all the quota approved endo programs are on ADA pass, and but there are some schools which do take separate applications also. But endo is not on match. So you don't get, just like for OS or for orthodontics or for other programs, there is a match portal. You don't have match for endo, but you do apply through pass. And like I said, some schools do have a supplemental application. So once you apply through, and also the deadline is pretty early for endo, so the sooner you apply, the better it is. Most of the schools, I think, stop taking applications by August end or 1st of September. And it is pretty competitive because most of the schools will just have 1 or 2 spots. Most of the schools are like that. So the sooner you apply, the better it is. It's all on rolling basis. And once you apply, application is pretty similar to what you do for CAPID. It's just that this one requires, whenever I applied, it required 4 letters of recommendation. And sometimes you would have to send some additional stuff to the school itself. But overall, it's all online. And you can have your faculty write the letters and everything for you. Yeah, and once you've submitted your application, you will hear about the interviews. Some schools start taking interviews as early as June and July.
Yeah. And suppose you want to get selected into this endodontics program, what do you think are important for any applicant?
So most of all, they would, whenever they read your statement of purpose, they would definitely want to know why you're so interested in endo. And here, I know in India, we have a rank-based system to decide what you want to do, but here it's completely on what you really want to do. So it's highly based on your interest. So that should reflect through your application process. And that's something that really, if you can show that through your application, then your application will definitely stand out compared to the other people who are applying. So apart from that, I think shadowing and endodontists are being completely involved. Say if you are enrolled in a dental program here, then showing that you have worked on some cases as a student will add to your application. And then shadowing an endodontist is also really important if you are a dental student here. Now, the other option would be if you directly want to apply for endo right as an international dentist, which I would say it is an option, but it's highly competitive. And I really don't regret any part of doing my DDS or my DMD from the US here. I know it was a lot of time and money, but it was completely worth it. So you learn so many things about patient management and everything. So like I said, the other option would be to directly apply for the endo program. And again, the same thing. Obviously, if you have a master's from your own country in the same field, then that would add to your application. Apart from that, letter of recommendation from endodontist is an absolute must whenever you're submitting your application to the BAS for endo.
Do you know that any international students, are they able to directly get into this endodontic residencies or master's program? Is it even possible?
It is. Once in a while, it does happen. So whenever, I'll be honest with you, whenever I applied in 2017, when I moved here, after I moved here in 2016, I applied to pretty much everything in 2017. I applied to DMD programs, I applied to specialty programs, and I applied to the advanced education and general dentistry programs also, because I wanted to get my license and I wanted to practice dentistry. So at that time, I did, based on what my application was, I did get an interview from UPenn for endo. So I was waitlisted. I didn't get accepted, but I did get an interview. So that kind of explains that there is a possibility. But again, there are some restrictions involved with it. Even if you get specialized, right, as a foreign trained dentist, then the problem is that you can't practice in all the states. So I wanted to be on the safer end, and I took the DMD DDS option. But once in a while, you do get accepted. But many of the states have a restriction of green card and being a citizen. Many of the schools have this restriction. So your options are pretty limited.
And how does the interview go? Can you tell me a few questions, like what exactly they concentrate on?
Almost every program asks you like, why endo, why not any other specialty? And then tell us about what kind of cases you have done. So speaking of that, I would like to mention that if you really want to do endo, then it's not a bad idea to document whatever cases that you have done, because it happened with me that whenever I was in the interview, they wanted me to show them what I have done. So sometimes it's good to show them the picture, because I remember one of the interviewers did say that pictures speak 1,000 words. So they wanted to see what cases I had done. So that's something that they asked, like, what kind of cases have you done? What are your future goals? Because here, a lot of emphasis is on being an academician. Also, I know a lot of people, after they've completed their residency, they want to be in private practice. But if you show them a little interest of being in academics and giving back from whom you've learned, or to the future generation, then that really, I think, is a good point to add. So that's another question that they ask. It almost always starts with, tell us about yourself. So if you start out right, I think, and show them through your answers why you really want to do endo, then you stand a good chance. And always put a smiling face, try to bring up a conversation. It should not be like no words at all.
And what did you say when they asked you that what cases, what maybe special cases you did in your MDS in India?
Well, I would thank my faculty in India for that, because we had a nice big photo album for everything. If you remember, Dr. Shenvi, we had to prepare a photo album. I actually had that photo album on me. So I showed them those cases. I know it had some aesthetic cases also, but some of the complex radix cases, and I did a lateral incisor with 2 roots. I think I worked on that case with you, so I showed
case.
that case.
I think we did struggle to finish that. It was new, and by that time we did not have controlled memory files. During that time when we were treating, I think we were trying to treat it with I think CM Pro Table. I don't remember that.
Yeah, I think that time we had recently received HyFlex control memory files, but we did finish that case.
Okay.
I do feel it could have turned out more pretty if we would have used warm vertical, but it wasn't bad. I did show that case.
Rare. I think it was. I have not seen any other lateral incisor having 2 canals till now. So you were quite lucky with respect to that. So how much is the, if you can give us a rough idea that how much these masters or residency programs in endodontic cost, and is it 2-year or 3-year program?
So here in the US, there are 2 tracks. One is a 2-year program, but it's completely a certificate program. And then another one is about a 27-month program where you get your master's also. So those are the ones where you have to do a thesis. But if it's a 2-year program, you don't have to do a thesis, but you will still be certified, or you will still be an endodontist. You can do pretty much everything. It's just that you won't have an MS degree. So it depends on the school. And if you really, really, really want to have an MS, then your options are very limited. So as far as the cost, obviously, if it's a master's program, it's going to be a little more compared to a certificate program. Mine was a certificate program, and I was happy doing that because my emphasis was more on clinical work, which I still did a research, but not a thesis. I did a full-fledged research, which could have easily qualified as a thesis, but it was not a master's program. So for the cost, the school that I went to is a state school, so the cost is less. I did have to buy my own microscope, so that was an additional cost. So in the ballpark, the cost would be about $120,000 for 2 years, and I'm excluding the cost of the microscope. This was an approximate cost, and as you know, there is inflation happening, so there is about 6% rise in fees every year. But I know there are some schools on the West Coast and some schools on the East Coast where the tuition is really, really high, close to $300,000. So it just depends on where you are applying. I was in a relatively cheaper school, I would say. Many schools would not want you to buy a microscope, but for my program, I had to buy a microscope. Yeah.
So which brand of microscope did you purchase?
So I have global A series 3-step magnification. Yeah.
Okay, I was seeing Ruddle's video today. One of the amazing lectures, and he had mentioned about the same brand. He has used it for many years before, and he said that the microscope is really nice. And Zeiss is there. Both were very similar, but he said nowadays the cost is quite similar to Zeiss and Global. So I am not sure. Today I just saw that. But it is how have you compared it with Zeiss and seen the differences between these 2 microscopes?
Yeah. So here in this, whenever I was in my residency, I had a separate operatory and I had my microscope in my operatory. So I use Global every day, all day. But whenever I went to conferences, I did try Zeiss. I would say the lamp brightness is something that really is important. So the brightness of the light is pretty similar for the Global and Zeiss, it's pretty similar. But I do think that the optics can be slightly better for Zeiss compared to Global. But there is a big cost difference between Global and Zeiss. So as a resident, I think I got Global at a very good price. but Zeiss can go up to 30,000, 35,000. And I know it has different filters, which will help you see a fiber post and everything. So it does have some special things, but honestly, global is not bad if you are wanting to invest in a microscope.
Now our department is equipped with 4 microscopes, and we have Labomed and we have Alsace. But my personal experience have been that regardless whether the loop or microscope, maybe we have seen the Admatec and other brands, the brightness, as you said, is quite good. It's quite good, although we have not come across the global brand. So, did they ask you that what different, what would be different? What do you think would be different, or you would be doing different in your masters in endodontics in this masters or certificate program compared to your post graduation? Did they want to know that?
They really did want to know that why I wanted to do it again, and I had my very important and clear reasons. I have, as a dental student here, I did some cases under the microscope, and honestly, there's a whole new world under microscope. When I look back, I really think that how did I even do endo with just without loops and without microscope? And whenever I was doing endo on the floor also, like as a dental student also, I always had my loops on, and my magnification was about 3.5 to 4. So, and whenever I had to do some procedure without my loops, I really couldn't see. So that was one of the biggest reasons I wanted to learn how to use microscope. And there is a steep learning curve to it. It's not like you can get that in a day or two. There is a steep learning curve to it, but it's completely worth it. So that was one of the things. And I also wanted to focus completely on endo. I know when your attention is divided, you sometimes miss things. I wouldn't complain of what I learned. I did do a lot of complex cases back in India, but it's pretty evident that if I'm not using magnification, I might have missed a lot of things. So that was one of the things, learning under the microscope. And I also wanted to be more comfortable doing the surgical procedures. So I missed on that whenever I was as a resident in India. And so that was another reason. And honestly, it might have happened because we were doing so many things. We were doing conservative dentistry, we were doing aesthetics, we were doing endo, but right now it was just endo. So we had time to focus on all the aspects of endo. So that was the biggest thing.
And I, as a person, this is my 10th year as a teacher now, as a faculty. What I feel is too much emphasis is put on how many patients you are doing per day, rather than how good the cases are, how different they are. So I don't know, maybe it is because we have to provide treatment to so many people who are needy, poor. Maybe that is a priority in our country. But somehow I feel, if you are, suppose when I try to work on microscope, or I tell my students to work on microscope, they cannot have 5 people outside sitting and trying to do that, learn that microscope, right? Because even with loop, initially it is so difficult. What is your opinion about this? That how can be masters different?
I'm glad you brought this point, because honestly, I was a little hesitant to talk about this. But yes, it is very, very true that here the entire focus is on quality. They don't focus on quantity that much. I was never overloaded with patients. We just saw 2 to 3 patients in a session. If I'm doing 2 treatments, I would just have 1 consult. So I never had this stress. And you're right, if I have 4 patients waiting outside, I would just want to wrap up what I'm doing just to be able to see the other patient. So here it was not like that. The entire emphasis was on quality. And I did a lot of single visits because I had time on my hands. And the focus was on learning the new equipment. Initially, when you start out, they would just leave it to us to decide if you really want to see 2 treatments in a session or you don't want to, because it's not easy with a microscope. It takes time to learn, to orient yourself. So they would give us that time. But I remember my time in India, I know I used to see like 8 or 9 patients a day, even if I'm just replacing calcium hydroxide, but it still takes time to get the operatory turned over. Sometimes you have to do that. I'll be honest, sometimes you had to do that, because if you're with a difficult case and you run over time and there is another patient waiting, I'll be honest, sometimes we had to do that. But here it's not like that. So a lot of emphasis is on quality we pretty much do a case discussion of every case that we have worked on. So our mentors look at all the cases that we have worked on. So that's something really, really nice. So yeah.
What is the duration? I'm not sure whether we have so much time to speak with you, but I have a few more questions to ask because I know you are a very good student. You know, one of the best students from our department in last 7, 8, or maybe since I had joined as a faculty. So how many hours per day do you have to have this clinical session, or when is your college or school start in the morning and when does it end?
Right. So as a first year resident, the focus was on didactics also, but I still had a fair amount of time in the clinic. So we had a boot camp for 3 weeks, and I do remember we had something similar back in India also, and that went on for like 4 or 5 months, I think, if I'm not mistaken. But I know we had to do a lot of things like restorations, learn about the veneers and all of that, do it on extracted teeth and the root canals also. Here, the boot camp was only for 3 weeks. And during the first year, we did have didactics. So I think every week I had, my school started at 8 in the morning and it finished at 5 in the morning with a lunch break of 12 to 1. So every day we would have lectures. I think on Monday and Thursday so the morning sessions were usually reserved for lectures in the first year. Also, there was one session for current literature, one session for classic literature, and then one session for pharmacology, oral medicine, oral pathology. And everything was very clinically oriented, very, very clinically. So they only taught what was important from the board's perspective. I have started with the boards. I have started the process to be a board certified endodontist, and I did take my written boards recently and I passed it. So I can say that whatever was taught was very specific and to the point and something that you can apply in the clinics. And usually the afternoon sessions were reserved for the patients. So, and some amount, it depended on the student and how they wanted to do their research. I sometimes since I had a microbiology research and it was a little complex, so I didn't want to invest a lot of time during my clinic hours, so I did it on the weekends also. It's completely up to the student on how they want to manage. But in the second year, it was all clinic. It was, except for the like 2 sessions in the morning for classic lit and current lit, everything was, we spend most of our time in the clinic.
That's nice. That's nice to hear. One of my colleague is doing residency in endodontics now, and I asked her because even I am trying to work under a microscope. As you said, it's very difficult, and but it is exciting. I'm trying to motivate people. I have shifted so many people to do. I brought loop, and my loop was sitting in cupboard for 3 years. And then when I started using it, I said, this is amazing. I do feel undergraduate should be doing it. Should be started from the second BDS. I hope everybody does this. So she was telling me that she doesn't have an assistant during the residency when she is working with the microscope. Is that possible to work under microscope without an assistant? I'm really not sure because I just spoke very little with her to know about this process.
I think as most of the times as a resident, you would not have an assistant. I did have some of my friends from different programs who said they had an assistant, and I was a little upset because I didn't have an assistant. But you learned so much. It's very, very difficult to work under a microscope, especially when you're working on an upper without an assistant. But I did it. I did it all the time. We never had an assistant. So it's difficult, but doable. You learn how to do it. But if you are in private practice, you will obviously have an assistant. The only downside is that when you're working as a resident without an assistant, you take up more time because every time you have to get the suction, you'll have to move the microscope and then adjust your magnifications again or fine tune. So that takes up time. It's a little frustrating, but it's doable if that's your question. But whenever possible,
no, what the difficulty is when we try to do access opening, even a little amount of water what falls on the mirror completely blocks your vision. I don't know, that is my experience when I'm working under microscope.
So I can actually send you a a link for something that my faculty recommended here. It's like an extra arm that you can attach to your chair, and you can attach your suction. So your suction will be closer to the chair. You'll still have to do it, but you won't really have to turn around to grab the suction. So I will send you a link for that. It's called a clamp or something like that. I ordered it off of Amazon. If you're working by yourself, that can be work as an extra hand. But I think sometimes front surface mirrors also help. Occasionally, I have worked under my loops to do the axis, and then once I'm in the chamber, I switch to microscope. That can help, because when I'm working on the lower, if I'm using my loops, then I hold the suction with my left hand and go ahead and do my axis opening real quick, and then I switch to the loop. So that can be an option. Then I switch to the microscope. So that can be an option also.
That's helpful, because I was not sure whether it is possible. If it is possible with everyone, so I'm sure we can also do it here. So my last question to you is, given an option, I have two questions. Okay, last two questions. Given an option,
fine. I have all the time.
Given an option, if you go back to 7-8 years down there, when did you join as for masters in our department?
2013.
2013. Okay, 2013. You go back to 2013. What would be 2-3 things you would be doing differently this time?
If I could, I would probably try to see limited number of patients. If I could, I know there is a big need of treatment, of providing treatment in that area. But if we could somehow streamline that and see limited patients, then I think what we are learning would improve by leaps and bounds, and the amount of confidence that we have will also improve. Other thing is, I know I spent a lot of time reading a lot of texts and so many presentations, and it's very, very hard as a human to remember all of that. So if I could, I probably would have watched the videos to learn things better. And there are really good Ruddle videos, like you mentioned. There are really good Ruddle videos out there which teach you step by step on how to do things. So that's one thing. And if I could do things differently, I would have emphasized more on learning what the article is teaching me, or learning how to actually critique an article, than to make a presentation. I think I spent a lot of time making a nice presentation. So, and in that process, you somehow lose. And this is how we did it here also. We never made a presentation. The students were asked to read the article, and then we discussed. So I think if we discussed, that might have been more helpful in a way, because you remember more when you discuss. So I think overall, I did learn a lot of things. Theoretically, I think you do learn so many things. What we learn in India, I think it's not comparable to anywhere else, because we do learn so many things. We read so many things, which here they don't put a lot of emphasis on preparing.
Yeah.
I mean, I really like the way they do it here also, because it's all clinical. Even as a dental student, everything is very, very clinically oriented. So yeah, I mean, I can't complain about anything, because there's something that you learned. If I had not done that, I wouldn't have been here. So I'm thankful always. But I think case review is another thing. I know we were always scared of case reviews. Whenever we had to do a case presentation, we were always scared. So
that is my next question. Scared because of maybe faculty's questions or whatever is there. But my last question is, what is your message to the faculties in India? How can they make endo better or teach endo better?
Honestly, if I look back at my time, I know there is a culture in India where you're always scared of teachers and approaching them with questions, because you think, as a student, you think that they might think that you don't know anything. But I never had that problem in my department whenever I was in India. I'll be honest, I think all my teachers were very approachable. So if I had a question, I think I did ask them. So I think it's more for the students to understand that the teachers are never going to think like that. It's just that you have to go and discuss about your problems or whatever issues that you're facing with them, because if we don't go, they would not know and they would not be able to help. So that part I think every single one of you in the department was very approachable as far as I remember during my time at KLE. So everyone was really nice. I never had that issue. But as a teacher also, I think if we try to bring in more of a discussion format, then that might be really helpful, because because then everybody would be responsible for something or the other, and there's something to learn from everyone, even if one student has missed one aspect of the article or particular topic that you're discussing, then they can learn from the other student who might have focused more on the other aspect. And I think reviewing cases in a timely manner, um, where students know that nobody's being judgmental of them, because we all will make mistakes in the beginning, that can really help improve their skills and improve their confidence. Because every time we have a case discussion, there's something that you learn, because there is a way of doing things. If I do things in a certain way, there is a way that certain faculty would do it in a different way. And if you discuss it amongst different faculties, then you would learn a different way of doing the same thing, maybe in a better way. So I think that can really help. I think discussion format.
That's very nice suggestion, and I do feel that that's really worth. I want to thank you for giving me your time and all this information which will help the students, and not just who are preparing to go abroad, but even the MDS students or even the endodontists who are listening to this, to think about the way they can be more passionate about endodontics. And for a teacher, I'm sure the end message are really helpful. Thank you so much for coming on Aspire 32, and hope to see you in India again. In coming days, it will be great to have you. Maybe to visit our campus, our school again.
Thank you, and say hello to everyone at school.